if you could, oh, thank you, Evelyn. I forgot. Yes, if you could please share your name, district, your role, and something that you are looking forward to. I can start. As you all know, I'm Ami Diallo, and I'm one of the youth housing initiative specialists here at COHHIO. You already know that. And what I'm looking forward to, I'm just looking forward to the beautiful weather every day. Like I'm looking forward to the sun. So you can either unmute and share, or you can share it in the chat since there's not a lot of people here yet. It's totally up to you. Okay, so on today's agenda. Oh, before the agenda, let's do some logistic. As always, please mute yourself if you're not talking. You can share your camera or not. It's totally up to you. Questions can be asked throughout the training. You can use the chat. Today's material will be shared on our website, as always, at cohio.org/homeless-education. We will have a breakout room today to have our discussion, as always. And if you have any audio and video issues, just exit and then come back, and it usually works with technology. Perfect. And on today's agenda, as always, we're going to do the welcome and introduction and discuss some key objectives of health opportunities, talk about community well-being, and then in our discussion group in the breakout room, we're going to have some discussion, finish with some question and answers, and do our closing as usual. So this is the wonderful COHHIO Course to Home team, our director, Amanda Wilson. You've met her. My amazing colleague, Evelyn Guerin. She's always here with me. Evelyn, do you want to say something?
Hi, everyone. Happy to be here. Happy to have you all here.
Yeah, Amanda is on her way. She's coming up from another meeting. And please let me introduce you to our wonderful guest speaker today, Patricia Clements, who is the project director at the Ohio Department of Health. Patricia, the floor is all yours, and thank you so much for being here.
Hi, good afternoon. Thanks for having me. If at any point I start to lose connection or you can't hear me, somebody just throw your hands up. That way I know to pause. I am going to go ahead and turn my video off because for those of you in the audience, I am in a conference center and my connection might be a little spotty. So give me just a second here. All right. So as mentioned, I actually go by Patty. My name is Patty Clements. I work over at the Ohio Department of Health in the Office of Health Opportunity. You can go ahead and click to the next slide, please. And my work there has been primarily around the social determinants of health and looking at that at both the macro and micro level. And we've created a couple of tools, and that's what we're going to talk about today. One of those being the Community Wellbeing Dashboard and one being the Ohio Health Improvement Zone Dashboard. I found out late last week that these links may or may not work. So try the QR codes. If not, at the end, we've got the link. Somehow somebody in our communications department, I'm not certain, these must have like time sensitivity. So I think we got it turned back on, but if it's not working today, please let me know. Next slide, please. So the Office of Health Opportunity does have its own mission. And, you know, really what we're talking about here is getting all Ohioans a fair and just opportunity to thrive in Ohio, right? And so really, next slide, please, we're talking about how where people live, work, and play, right, impact their health. And they shouldn't be left behind because of those indicators, right? So here are the objectives for the office, and really we're going to be talking about number 3 today. So we've done a lot of work in those other 3 buckets with this equity grant that we received about 3.5 years ago now. We're in our 2nd extension of it. So we're going to keep working in bucket 3 to move really some of those community conditions into a better space. Next, please. All right, so the first dashboard I want to talk about is the Ohio Health Improvement Zones. And some of you might be familiar, but maybe you are not. They call it the Social Vulnerability Index. It was created at the federal level, and there's a really robust and fantastic website that's housed at one of the federal agencies that really does talk about social vulnerability across the United States, right? And in that particular website, it kind of ranks, if you will, every census tract in the United States against each other in these 4 areas. So each community, and when I'm talking about community here, I'm talking about a census tract, is ranked in 5 areas, right? A community might have an overall vulnerability number, and then they have a vulnerability number attached to each one of these subcategories. And you can see to the right how we came up to these subcategories. And those indicators over there in the far right column realigned in this last American Community Survey. Some of those were kind of scattered a little bit. So a community's number has likely changed. And for example, in Ohio, we added, goodness, I think it was around 2,000 new census tracts, just the way they do it population wise. So we've updated our data, but really what the takeaway for the SVI is that when a community has an SVI of 0.75 or higher, either in overall or in any of these subcategories, right? It becomes really difficult for a community to withstand some emergencies that happen. So think about how the pandemic hit our community, right? Think about the train derailment up in East Palestine. Think about where some of those tornadoes have happened this spring, right? When communities have high SVI areas, it does make it really difficult for them to recover from situations like that. Next slide, please. So here is a quick snapshot. I used this particular slide in another presentation, but I thought it would be a great example to share with you guys. So these are 6 of the largest cities in Ohio, right? And so the darker the color, the higher the SVI, right? So we kind of expect to see some of that happen in some of our inner cities, especially when we know what else has happened historically in those areas, right? And things that are continuing to happen. Lots of you are probably operating homeless programs in these areas, right? And your ESCs probably, some of your local school districts are having some of the most significant challenges here. The one thing I do want to let you guys know is that in the Ohio Health Improvement Zone, like in our map, our formulas changed just a little bit from the federal. I should say the formula is the same, but what we decided to do was that we're using the Ohio Health Improvement Zones as a place where we believe we should be doing targeted investments. So we wanted to make sure that our dashboard and our map reflected how Ohio communities compare to other Ohio communities. So there might be some census tracts in here that have a higher SVI when you look at the Ohio map versus when you go take a look at the federal map. It only happened in a few instances, is what our data people are telling me, but just in case it's one of your communities, that would be why. Next slide, please. So I'm going to encourage you guys to go play in our dashboards. The reason I don't do this presentation live is depending upon where I am, who else is logged on, sometimes both sites get a little bit bogged down. We are currently revamping the Social Determinants of Health dashboard, which is what we're getting ready to get into now so that it will load faster, but that won't be available until June. So a couple of things I wanted to highlight, especially for this conversation today, is taking a look at housing and transportation and racial and ethnic minority status at a very, like, at the macro level here, right? When we're looking at the state of Ohio, you can kind of see where some of those darker colors cluster, and there are places, especially in the racial and ethnic minority status map, where we think and where we know folks are living, right? Housing and transportation, the same thing, except when you go to the map and you kind of zoom in the urban areas, you'll get a much better picture. But the one thing I always like to point out is that when you're taking a look at rural and Appalachia, Ohio, housing and transportation become just as problematic as it can in some of our urban centers, right? Because when we talk about housing in the rural and Appalachia area, we're talking about housing that is, centuries old, that are as lead-ridden as some of our housing stock in the urban areas. And so those become significant challenges. Access to fresh water and those types of things still are an issue in some areas of Ohio. Next slide. Okay, go one more, please. All right. So the social determinants of health, that's how I refer to it. It's on the Data Ohio platform as the community well-being tool. At this point, if you're familiar with the Healthy People 2030, we kind of structured it after that in that there are 5 domains that we kind of group together these data points, right? And so that's around economic vitality, neighborhood and physical environment, healthcare and access, education and access, and social and community environment. We do also have this landing page here that you see to the left that kind of gives you like an overview of the people living in Ohio, right? By total population, male, female, kiddos, those who are aging here, the total number of census tracts, right? And so there's about 151 data points in here right now. We have 2 more data points that are going to be added hopefully by June when you see those. So we'll pop that number up. And one of those is probably going to be most specific to you guys. I'm not certain if I was able to put it in this presentation because it hasn't been approved yet. But we were able to help paint a better picture around housing issues in Ohio. So the current dashboard has those paying more than 30% or 35% of their income towards their housing cost, right? But I was able to get some data points when we're going to talk about extreme poverty, right? And when we're talking about that, we're talking about families who are spending 50% or more of their income on housing. That paints a really bleak picture for those of us in Ohio. So once that data is available, and I can send a screenshot of what that kind of looks like at a higher level to the folks so they can share that with you guys, just because I think that that's a really good talking point for you guys in your local communities about the cost of housing and accessibility, right? If people are spending more than 50% of their income on their housing costs, they are making daily choices, right, about feeding their families, paying their utilities, transportation to work, clothes. I mean, they're in a situation that we have to find a way to articulate to folks, right? Like just how dire their situation might be and how the decisions that they're making really are crucial every day. Next slide, please. As I'm moving on here, up in the left-hand corner of that last slide, you would have seen the total population of Ohio. That's because it's a little lower than what most of us use when we're writing federal grants, but that's because the ACS only allows us to use like the people who get to respond to the survey, right? They don't get to be incarcerated. They don't get to be in long-term housing facilities. They don't get to be, like DD folks living in long-term housing situations. Homeless folks aren't always reached when they do that survey. And then the aging and nursing homes. So that number is really just over 12 million. Like that's the going number that we see in Ohio. So here's some other screenshots I want to show you guys for what the dashboard looks like. So they'll kind of fly in one by one. So okay, if you go ahead and click first, I'll tell you what we're going to take a look at here. All right, so this is talking about housing. This is where I'm talking to you about right now. Oh, look, I was way ahead. This is what the map looks like for Ohio at 50%. So they let me slide it in. So when they send out the PowerPoint presentation, go ahead and take a look at this. Those dark red areas is where the vast majority, like if you look at the scatter chart to the right there, it tells us the percentage of population in those areas that are spending more than 50% on their housing. So here's a great thing about the map. When you're able to go into a live, we have a lasso feature. So like say you're really interested in that 20% or higher, you can just take this little lasso and circle that. And when you click on it, then the map will populate and it'll show you exactly where those communities are at. Similarly, you can hover over the little bubble and it'll tell you the census tract and which county it's in. Next slide, please. All right, this one is talking about low access. Oops, can we go back one more? So this one is talking about low access to food. So I tend to ignore the chart to the right. It's going to be fixed for us because it's just really complicated to talk about how that access over there works. But really what we want to talk about is who has low access to food. And you can see that in the orange, right? So if you can put these two maps beside each other, right? And you're taking a look at who's spending more than 50% of their income on their housing, lots of those same communities have low access to food, which means we know that they're going places that they can't afford to buy their staples, right? Or they're relying on food pantries. Next slide, please. All right, this is the National Walkability Index. We take this from ODOT. Where's my little eye at in this? So up here on the right where it says build environment, you see a little eye there. If you click over that when the dashboard is live, it'll tell you where we get our information from. So really the vast majority of Ohio is not walkable. All right, when they do the walkability scale, it's talking about access to sidewalks. We're an incredibly rural area, right, in Ohio. So just by virtue of the definition, it's going to be problematic. Except it's important when we start talking about chronic diseases, right? Like all those health related indicators that fall into chronic disease where doctors are suggesting or maybe even writing prescriptions that people go walk. We know that that is going to be a challenge for most Ohioans, right? Having somewhere safe and accessible to go walk. Next slide. I think I've got one more flying in. There we go. And this is a percentage of households without a vehicle. So back to that very first slide when we were talking about transportation and how those barriers can be. And you can see I tried to blow this one up so it's just a little bit distorted. Again, you can see where the pockets are with so many households without a vehicle. Again, you can go over to that scatter chart and maybe you're really only interested in like where it's 40% or higher. You can circle those and figure out where that is happening in Ohio. The other thing I want to make note of is as you guys go through the dashboard, you're going to see what we refer to as levels of stories. We spend a lot of time, like most dashboards, they don't have a lot of context. There's not a lot of words on them. Usually you're looking at pictures and data, and the data moves, based on what you're taking a look at. We did, and we were very intentional when we built this initial dashboard to put a lot of words on it because we wanted to contextualize and help people understand what they were looking at. And anywhere you see that little eye through the dashboard, you can click and you can see every data source and every citation. So it'll take you to further reading if there's something that you're really interested in. And we were pretty intentional in that because we want people to be able to use the dashboard at the community level to tell their story, right? And sometimes you need that data source to be able to dive more deeply into the data as it pertains to your community. But we do want you to use that information when you're writing and asking us at ODH for some funding. And we could talk about that more in a little bit. Next, please. All right, so the next few slides are really just talking about in each of those 5 domains, really what we're trying to do in the Office of Health Opportunity and how it pertains to those areas of the Healthy People 2030. And so there's a couple of slides hidden behind these that I can ask them to unhide when they send them to you guys if you're doing some of this work in your community, right? And so the takeaway from this slide is that really at ODH, we're trying to promote and innovate public and private partnerships, right? We're really trying to create sustainability around these programs. And then the next slide that I only took them out for the sake of time, has like a series of 4 or 5 prompting questions. If you're having these conversations in your community, how you can engage others, how you get them to the table, how you help them carry the mission forward, especially around this topic of improving economic vitality. Next slide, please. Again, similarly with the neighborhood and built environment, really we're trying to identify cross-sector support and funding to expand infrastructure, improving capacity of the residents and agencies, right? Nobody can advocate better for somebody than for themselves, right? So we really want to make sure that folks have the skill, opportunity, and access to be able to advocate and tell us what they need happening. And this is where I'll give us a shameless plug. Our Ohio Health Improvement Zone projects, we were able to use some of our equity funding from the CDC to let communities come tell us what they needed. So they wrote their own plans, they engaged their own health improvement partners, they led all of their work, and we gave them funding, provided some technical assistance, and then really just got out of their way to do the work. And so that's been really great. Next slide, please. Improving healthcare access and quality. It seems kind of self-explanatory. That last bullet there, we did some of those mobile clinics and drop-in clinics with the COVID vaccines. ODH has the home visiting programs. I know that those are moving over to the Department of Children and Youth. We're continuing with healthcare screenings and partnering locally to be able to do that, helping with Medicaid enrollment where there's an opportunity to. And then really leaning on our community partners to talk about what's available locally. Next slide, please. education access and quality. Again, we do really want to collaborate with schools and local stakeholders to facilitate access to physical and mental health. And I'm super excited that the governor has put a lot of money into those couple of school-based health center projects that he's been doing. I shouldn't say a couple, there should be quite a few that come out of that. We did use some of our equity funding to do some school-based nursing as well as some school-based health center work. And then also in this area, we're currently working on a project with the Department of Education and Workforce and hoping to bring Medicaid to the table to take a look at student data, chronic absenteeism, and chronic health conditions to kind of create a tool that can be used at school-based health centers and at the school district level to get folks connected with resources and really for folks in the school building to understand what's happening in the community and how we can be of help to them. So that's really in its infancy. And I expect that might even turn into like the dashboard we just took a look at, community well-being, right? There's some conceptual ideas floating around. Could we create a youth SDOH tool, right? Because resources that are available to youth might look different, they might feel different. And so we're trying to explore what that might look like. Next slide, please. Improving social and community experiences, right? We want to make sure that the interventions are there to help people get the critical care that they need, like that dosage, right? The right intervention at the right time for the right amount for the right person. And really leaning on the communities to tell us what that is instead of us coming in and telling them what it should be. And we do spend a lot of time talking to our sister agencies and our local health departments and any partners we have at the table. That third bullet, right, around engaging residents and communities as a whole, right? It's not good enough to really just put out like some kind of, hey, come to this meeting and give us some feedback, right? It's really about meaningful engagement, hearing what's being said, helping get some of those changes in place, funding in place, services in place, interventions in place, so that communities can be healthy and thrive. Next slide. All right, so here's how you get a hold of us. That is our email there. We don't have an agency liaison with you guys yet over at COHHIO. And then you can find the dashboard on the Data Ohio portal. I think that just quickly, I'll give some caveats about what you don't see in any of those dashboards. When we were looking for data sources, it became really difficult to find publicly available data at a high enough level around the populations that you guys are serving, those who might be transient, those who might be homeless. There's no crime data, there's no neighborhood safety data, there's no redlining data. Like, we were really careful to make sure that when you take a look at a community that you can see opportunities and needs, right? So that we can make investments so communities can start to thrive. When you start putting in some of those other layers, we were a little concerned about what some of that messaging would be and that it might not be beneficial for our community. That being said, we have an awful lot of conversation around how do we help folks who are unhoused, right? Because that's a continuum. When we use that term, right, that's a continuum of folks. And is there a way that we can get some of that data in the dashboard? If not, how do we help you guys tell your story about what communities need locally, what you guys need at the state level, and what advocacy we can help with at the federal level? So I know I talk fast, but I do want to give plenty of opportunity for anybody to ask questions, give suggestions, give feedback, talk to me about how you think the dashboards might be useful. If there's some information you think could be useful that, if you've been on the dashboard and you want us to take back and consider to see if we can find a source, we're happy to do that. The data in the dashboard will be refreshed with the 2021 data by June. So they're in the process of updating the most recent ACS tool that's out there. And there are a couple of data sets that haven't been able to be updated since COVID happened. And it's not through us. We're hoping that it will get updated this time. But for example, in the food security area, there's some SNAP data. The last ACS update last year, SNAP did not update their numbers. That's the reason that that particular area is not quote unquote current in my mind. Any questions? Anything else you guys would like me to touch on?
Got a quiet group today. Hey, everybody.
Hi.
I was late. I'm sorry, I was coming off another meeting. Thank you so much, Patty, for that information. We've got plenty of time. I know that our team came up with a couple of discussion questions. We did have one comment in the chat about transportation in the Appalachian counties and how big of a challenge that is there.
Yes.
Not really. I mean, I know those of us in the urban areas can be like, oh, you just ride share. And then like people are like, no, there's no ride share in some of the areas, you know, let alone public transportation options.
Right. Well, then rideshare is so complicated if you have kids, right? If you're taking care of somebody with a disability or an aging parent, right? It becomes really complicated. It seems simple, but it becomes really complicated very quickly if your day doesn't go as planned.
Well, did I unmute? Can you hear me?
Yes.
I was the one that asked that question, and it was specifically related to homeless youth and schooling. And when you get into Appalachia, you also have much longer distances. We have a very large county that's close in area to Franklin County that has 3 school districts. So on top of the additional expenses of transporting students, you also have those issues related to transporting students potentially back to their school of origin, which could be 30, 45 an hour, minutes, an hour away. So, and I'm laughing to myself partly because I read an article that came out of one of the national agencies that deal exclusively with homelessness, and one of the very reputable ones who had a featured article on homelessness in rural America. And one of the suggestions was that school officials who are struggling with transportation consider taking a look at public transportation. There ain't no such thing. Nobody in Tuscarawas County is hailing a cab anywhere. Nobody's jumping on a city bus. So, I have to admit that my questions are based on what I feel is a real disconnect in understanding. I think there's a sympathy to Appalachia, Ohio. I don't think there's still an understanding much beyond a county level. And just a couple of points and then I'll shut up. Maybe I won't. You know how that goes. Chapin Hall suggested that in a given school district, one could expect, somewhat based on demographics, one could expect about 2.4% of their students would be homeless. In rural America, that presumption jumps to 4%. I don't want to get into a war about who has worse again, but I don't know that factor is fully embraced in how we reach out. And I don't know if I can get my camera to, can you see me?
No.
Be glad for that.
Nope.
Well, anyway, there's I'm sorry, I'm trying to play with my camera. There's some resources that came out of Broadband Ohio. And we just looked at those again at another meeting this morning. That is in a similar mapping scenarios we saw earlier. Broadband Ohio has mapped out by county, counties with, according to their broadband access. And basically, variations of green color show sufficient access. Red is insufficient access. 79% of the population of my county does not have access to minimum broadband, as opposed to 11% of Tuscarawas County. That constitutes 30% of our households, as opposed to 2% of the households in Franklin County. So again, I don't want to get, I wouldn't want to get into a discussion about who has it worse. Again, I'm just saying, I think the understanding beyond the numbers is a hard message to get through. So I guess I'm trying to continue to feed that message that it's a lot deeper than it seems a lot of folks understand. And the last one is that has made the ESCs in these areas so much more important, because the little bit of money that comes available for various issues, including McKinney-Vento again, doesn't constitute enough. Well, there's never enough money, I get that, but very small amounts of money that schools have to work with, and the opportunity to engage in some economy of numbers and multiply those services for people that we're unable to do. So I just want to, and I just hope we continue to expand our thinking into the intricacies of this culture beyond just the numbers. The numbers are bad enough, but there are a lot of other considerations beyond them. All right, I can mute now.
So I think he brings up a couple of really good points. And I think that what we need to focus on is that one area isn't quote unquote worse than the other, right? They're different and they're problematic, and we have to dive into each community to let them help us figure out how we meet the need, right? So there's not going to be a one size fits all across the state, and it might look very, very different, right? And so I think that we have to come together to advocate and tell our story and help people understand why it looks different in rural Ohio, right? Because the one thing that I will say about this is that with all the money that's going to Appalachia, there's still significant portions of Ohio that are rural that don't meet the qualifiers to get access to some of that funding, right? So we do need to spend some time really talking about how do we help improve housing situations for everybody across Ohio, knowing that it might look 5 different ways in every single county, because communities are so different.
I won't challenge it, but the presumption that just because it's rural, across the board, the county's in trouble. Belmont County's in trouble. Guernsey County's in trouble across the board economically. That's just a given. And I don't want to get political, but the whole issue of what's happening with farmlands and subsidies and all those things are contributing to are exacerbating a much bigger problem. I just don't want to. Let me put it this way. I've been through about 6 occasions this year, specifically related to services for homeless youth, and a couple because of attendance economy. Invariably, I can't tell you how many agencies that have services available begin with a map that says this is where we have services available. And my favorite is the one that has 3 offices in Cincinnati, Cleveland, and Columbus, and then puts everybody else in the same office. They don't even have a contact person for our area. So I understand that some of my concerns about kind of being thrown into the statistical mix are based on the fact that even if the service needs are identified, we're finding fewer people who are willing or able to provide those in our area. If I go to Canton or Akron, 45 minutes to an hour north, yeah, those services are available. All right, I promise now I will shut up.
Yeah, thanks, Scott. Yeah, it's tough when and I don't, Patty might speak to this more, but like when we're looking at data, it doesn't, I mean, it's important, but I love what Patty was talking about with the context, and providing that textual description and thinking about what the nuance is. Cause yeah, when we're making generalizations across the state, things get lost. So it's finding that sweet spot where I think, and y'all can agree or disagree, where we're recognizing local need and then also, considering trends like, housing. I mean, from the COHHIO standpoint, housing is a statewide problem. It looks different in different places, but it's a statewide issue. So I think that, yeah, it's important to think about the data in a nuanced way. But I don't know, Patty, if you have anything to add to that.
So I think I agree that the numbers can be tricky, right? So we spend a lot of time talking about and talking to our locals and our EPIs about disaggregating data, right, at their local level so that they know who's being impacted the most, right? And then kind of rolling it back up to tell a story. But I think that it's vitally important. Like you can look at our dashboard. So we use Tableau. So that might not be relevant for some of you guys. But the reason that I can't overlay all of those SDOH factors to really get a comprehensive, in-depth picture of every census tract is because Tableau doesn't allow us to do that. But if you were able to imagine each of those maps, right, like as a transparency, I'm going to age myself, a transparency like back in school, right, laying those clear sheets over top of each other. And then the darker a community gets, then you know that they have all of those underlying issues, right? So Scott, back to your point, it's one thing to identify that there are some things happening there, either in isolation and in their own silos or across the spectrum, and then having access to resources, right? Because that is certainly another issue that happens in rural and Appalachia, Ohio. Sometimes it becomes really easy to talk to people about what we need, but getting access, right? Getting the resource there in a way that community members understand it, that they're willing to access it, all of the things, right, that it takes to get folks engaged in any of the resources that they might need, is its own unique challenge. And so that's where, when we did our Ohio Health Improvement Zone projects, we really did tell the communities, we're like, this isn't a trick. We don't go to communities this way very often, right? Tell us what you need. We're not going to presume to know exactly what's happening in your community, what the best intervention is, how it should be delivered. We want you to tell us what you're going to do, and we're going to fund it and get out of the way. And then we're going to help you evaluate the effectiveness of your strategies. Did it work in that census tract? Did it only work for certain people in your census tract? And I think that those are vital. But Scott, I want to make sure that you know that we're hearing you, that we know that there's a resource issue up in your area. We also know that when we talk about Ohio broadly, that it doesn't necessarily represent your community. And I think that those of us, when we're sharing data and talking about projects, that we do need to be mindful that people don't get the feeling or the impression, intentional or unintentional, that we are surmising and grouping everybody together, right? That we really do need to dive in. Because I think somebody over here in the chat asked if we could do, slides for community, and we do. And we, oh goodness, one of my gals does it, and I forget what she calls it, but it's like community and place or something like that. And so she'll, like, if there are data points that you're really interested in, she'll go dive and get those out of the dashboard and create a custom kind of PowerPoint to talk to you about what we see in your community. Then you tell us if it feels like that. Again, data is just like one little piece of talking about what's happening in your community, right? You can't let it drive everything, but it is certainly a tool that you can use to help tell your story. I'm sorry, now I'm done rambling.
No,
thank you.
Yeah.
You probably need, I can't find a way to mute myself. I'm on a tablet, so feel free to do that from your end.
Okay. If we don't worry, if we hear background noise, we'll mute you. Yeah, so I don't know if other folks have anything they want to share, whether a question for Patty or you know, what kinds of things you're seeing in your area as far as like when we think about these social determinants of health, you know, and we think about student well-being and connecting what's happening in the community to like what's happening with your students in your area. I don't know if anybody has anything they want to share about what they're observing or any kind of questions. I won't put anybody on the spot, but I wanted to put that out there.
I don't know if this is something that the Department of Health could help with, but I just learned of a problem that we have in our community is if a family is working, but yet, you know, the lowest part of working, but they are working, they have private insurance, we can't get school-based care because the insurance companies will not allow that. And that seems like a crazy rule because they're barely making it. They can't take off to take their kids to the appointments. We have school-based mental health services where the students could be seen, but yet we can't because they're privately insured. Does that make sense?
Well, it doesn't make sense, but I hear what you're saying.
Yeah, that just seems like, wait, what? I mean,
Right.
because we all know that there's a little bit of a mental health thing going on. We have the ability to do the services and then we can't. So it's just kind of, it's frustrating because the parents are trying to do what they can, but it's hard to get off work.
Yeah.
And it's hard to drive places and it's hard to do this and it's hard to do that. But if you're not working, you get services. And it's just kind of crazy.
So in your area, they either need to be uninsured or on Medicaid.
Right.
Okay. I had not heard that yet. So
Yeah,
I'm going to go ask some questions.
Private insurance companies do not allow school-based mental health therapy.
Okay.
Thanks for bringing that up, Amy. And yeah, I mean, you raise a good issue. You know, we've been talking about some environmental factors, but the mental health issues that are going on everywhere, but especially with our young folks. And you know, I see connections there with like, you know, what's happening, you know, obviously with their housing situation, with access to resources for basic needs in the community, and that stress compiling on trauma and affecting, you know, mental health. And there could be existing, you know, mental health issues also, and then trying to figure out how to get students that support's challenge.
Yeah.
Other folks on the call, anybody have any questions, comments about what you're observing in your community? I know we have a smaller group today, so we might, you know, not need our full time since we have a smaller group.
I mean, do we have evidence of all of those social determinants? Yep. Yeah, we do. We don't have the solutions. That's the issue. Oh, but you know,
Yeah, translating data to action. I don't know if you want to speak any more on that, Patty, about how the department uses this information to drive programming and initiatives in communities.
So I can speak on it at a high level. I would love to say that this is new to us, but that's not necessarily the case. So, you know, typically at ODH, our programs are really driven by our funders, right? CDC, HRSA, those guys. They kind of have historically told us what they're going to fund, who we should engage, those types of things. But really, I would say since this most recent Healthy People 2030, you know, so that's a 10-year span, so it would have come out right before 2020. And then the pandemic was happening, right? Really pushing community engagement and community innovations. And for example, a number of the COVID funding streams really have allowed us a lot of flexibility in what we're going to fund. But it did tell us that we needed to talk about data. So one of our pillars back there in that one of those first slides that I shared was they talk about data modernization, and that could mean a number of things, right? For us, it became not only having access to tools like these dashboards, right? We created a dashboard. It's not publicly available, but it did track COVID data, and we were tracking death and hospitalization data. And that became really important for a number of reasons, right? It helped us inform the decision around who the first group of folks were that were going to have access to the vaccine, where we would take the mobile clinics to, how we were going to engage folks, right? Because without looking at the data, right, folks in the room were talking about who gets first access, right? It needed to be folks who were still working in those first, whatever word I'm looking for here, like the first responders, right? All needed to have access to the vaccine first, people at the hospitals, those types of things. And then we started talking about the elderly. So there was an initial number kind of thrown out, but if you start to break down Ohio's demographic, we start to find out the life expectancy, you know, across populations in Ohio don't match. So if we kept arbitrarily, I'm just throwing a number out there, if we kept that number at 75, right, there were entire populations where the elderly weren't getting any access, right? Because that was their life expectancy was below that threshold. So that was one of the first times that we really were starting to take a look at some of the data and what we were doing. The other thing with ODH historically, and you know, I can say this, I have only been here for 2.5 years, is that we intentionally weren't tracking data for some of our projects, right? Because we didn't want to have to ask people about things. So like think about the car seat program, right? We wanted to get car seats out to as many people as we could, and we didn't want to have to take any information from them. I think they had to verify like that they lived in the county where they were being distributed, right? But when you go back now we're starting to ask, we need to make sure that the right people are getting engaged and have access, right? Because we still now have entire populations who don't have access to the free car seats just based upon where we're distributing them, right? Like that's a really easy kind of non-confrontational conversation to have, right, about car seats. But when we start having those conversations about things that feel different and make people uncomfortable, when we're talking about folks who are historically marginalized, that's what we're now starting to use that data for, right, for to drive programming, right? Think about like smoking cessation, lead, cancers, what we're finding out about some cancers and where they're the most prevalent, right? The right intervention at the right time with the right folks. That's where our money needs to go, which is why we're using these dashboards. When we put out our RFPs now, we're asking folks to include equity related information. We're asking them to use the dashboards to talk about their community. We want to make sure that they're targeting the highest need and the highest risk folks in their communities with the correct interventions and as they're asking for funding. And we're not the only ones doing that. It's happening across state agencies. And so it's good to see that we're being intentional, right, with what we're doing.
Yeah, thanks for that. Scott asked in the chat if you have any data yet about school absences and health. Like, do we know what's happening with young people that are missing school for health related reasons, or is that still in its early stages?
So I know it exists. I'm trying to get access to it. So I have to be really careful here. Medicaid has access to some of this data. Again, though, there's really only ties back to Medicaid kiddos. All right. So a couple of things we can infer from that, right? Like the Medicaid population is large enough that in certain school districts, you can make some, and I'm using air quotes here, some assumptions about access, right? And the types of issues that are there. But for example, they can talk to us about kiddos who are missing because of asthma related issues, that they could talk to us about some of the kiddos who might be missing around diabetes, but that's really, the diabetes one is tricky because they're only tracking it if they need to have the nurse administer insulin or do some other intervention, right? Otherwise, if a kiddo can handle it on their own or they've got a pump, then it might not, then those forms aren't being filled out. So what we're trying to get is those the healthy student profiles. So DEW, their acronym has changed, so it always throws me for a loop. DEW gathers a bunch of data, Medicaid has a bunch of data, ODH has a bunch of data. And if we can get all these data sharing agreements in there, and since Medicaid already scrubs and gives them a unique identifier, we should be able to theoretically at the census tract level and maybe even the school building level be able to figure out what's happening by some of those chronic diseases and even kiddos with cancer, right? When they're missing school, how much school they're missing, what interventions they may or may not be getting to help keep them on grade level, access to healthcare. Are they using the school-based health services? Are they utilizing the behavioral health services that might be available? So we think that we have the pieces to be able to figure that out. It's now getting to the ability to be allowed to do it.
Awesome. Thanks for that. And there's a follow-up too from Nicole about if there's any comparison data for schools that have full-time health services versus part-time or none at all when looking at attendance. So are we looking at who has nurses or whatever on staff or who doesn't? Or are we not looking at that yet?
I'm not certain, but I can ask our school-based health folks. Our issue around this particular question, it gets tricky because schools aren't required to have nursing staff. So for many of us, we take that for granted that there's a nurse at the school or an LPN or somebody acting as such, right? And not Miss Sally, who also answers the phone and giving out Band-Aids, right? And I think that we'll have a problem getting at causation, right? There might be some correlation that we could figure out how to get to. But I think that that's a question clearly somebody is asking, right? Because we've been funding school-based health centers, Medicaid is funding school-based health centers. The education folks are saying, bring them here. People trust us in the community. They'll come use our services. The governor's putting out millions and millions of dollars. So somebody's asking that question. I just don't know where the data is going to land. Right now, that's not in my shop, but I certainly can ask some questions and pass that back along to Laura. I think she sits in on several groups with you guys to be able to share some of that out.
Cool.
But it would be great data to have, I agree.
Other questions, comments folks have or want to share or add to what they've talked about?
Just to follow up on that comment that I made, it is interesting that all of the talk that hasn't come up yet about somebody being full-time. I know we're in Kansas City, we've been kind of toying with some other, like we have nurses on call, and we can do some virtual appointments and things like that. But Patty, when you said, like the person that's answering the phones is also manning the clinic, I know that there were times as a principal that I actually even sat in there. And while I think that I'm a nurse sometimes, I'm not.
Right.
And I do think that having somebody available to the community for them to come in and chat with, I don't know. I mean, maybe not. That's why I asked about data, because sometimes, again, if the trust is not there, they're not going to tell the school nurse anything more than they did, to their whatever resources they have. It's just a tough issue, and the absenteeism is just so. And here's the thing too, but even if you had a school nurse, like some of our other issues that I liked how you put it about the transparency, and you're right, people that aren't old enough to know what that means. I was a big
Yeah.
transparency user when I was a teacher. But no, just thinking about just, I can't even offer school-based health if they're not here. And
Absolutely.
that's the biggest thing. So I
Absolutely.
appreciate your comments. And yes, I'm going to take you up on a one-on-one session, because I just wrote a grant for the McKinney-Vento money for Ohio, and something like that would have been so helpful, because I was kind of all over the place, because there's just so many, you can't really pinpoint what the biggest problem is, I
Well, they
guess I
start
should say.
compounding each other, right?
Of course,
Yeah.
yes. So I appreciate that, and I look forward to talking to you more, or you putting me in touch with somebody else. So
Absolutely. Sounds great. Hey, Scott, I see your comment over there. This asthma #1, diabetes #2. I'm sure obesity is up there. I'm at our public health conference, and I was just told this morning that we're like #7, right? So the new Sean Ship is going to come out talking to us about exactly the things that you have over there. We've got to target asthma to who's carrying the burden, right? We can't just blanket have conversations around who's impacted by asthma, right? Like asthma right now, the burden is being carried by Black adults and Black kiddos. The intervention has to be targeted to drive those numbers down. Diabetes data that varies across the lifespan, but childhood obesity and the aging obesity numbers are going to be things that are going to be written in the SHAW, or in the SHIP rather, sorry, because in the SHAW it told us we're doing horribly. The nation is telling us we're #7, and that is certainly not a place we want to be, because it compounds all the rest of the chronic health diseases that we have going on.
Amy, did you have a comment?
No.
No, just,
I
we're
can
happy to
speak
see
we
your
have
face.
nurses. I can speak to we have nurses. The issue is keeping the nurses, because the pay is so low. Nurses are getting way better out in public. So keeping the nurses to build that trust and relationship is a whole other ball game. I don't know how we would function without them though.
Yeah, see, we have very few. I don't think we have a school that has a full-time nurse.
Yeah.
But my frustration, frankly, has been I've been in a lot of webinars concerning attendance, and I keep saying, how can we deal with attendance if we don't know why kids are missing school? I get all the need for wraparound supports and a comfortable environment and all of that, but my problem is I would rather see nurses and stethoscopes in schools than armed guards, but that's my problem. But I just think that a health professional in a building can do more than anybody else to improve attendance, and that just doesn't seem to be where we're putting our energies. I was a very small parochial school, and I had a nurse who was incredible at when parents would call in and say, my son has a sore throat, and the conversation is, really been to the doctor? What are they about? And those kind of questions that parents have that they don't know where to go. And it's gotten worse because they don't want to spend $100 on a call to the office to find out that, no, that doesn't sound like strep, give them a cough drop or whatever. So I just feel like we haven't gotten to the point where we know what we're dealing with enough to know how to correct it. And particularly with homeless youth. And just a thing going back to, a lot of schools in the broader area have had that issue because Medicaid loves the kind of clinic, the school centered, telehealth centered kind of. I think it's because it's cleaner and perhaps a little more connecting. But we've had schools that have had that private pay does not like it at all. And for whatever reason, it just is an issue.
Yeah. Good points, for sure. Other comments, questions, things folks want to share? Well, I know we're technically slated till 2:15, but like I said, we had a smaller group today. So I am, fine for us to end a little early if everyone feels like they got to share their comments and questions. I just want to say thank you again to Patty for being here and having this conversation with us. And thank you to all of you for participating. And sharing what's happening in your community and asking questions. And so I really appreciate everybody. Evelyn, Ami, Ashley, anything I'm forgetting that we need to talk about before we close out today?
Just
No. Oh, go ahead.
I just put a link to our feedback form in the chat. We love hearing your feedback, and if you want a certificate of attendance, you can indicate that in that form. So you can expect that in the next couple of days. And our next session, I believe, is on June 11th. So we hope to see you all there. And I think that'll actually be our last ever Homeroom Network community of practice. So that is weird and bittersweet. But yeah, we will be reviewing our toolkit for schools. So we'd love to have you all there so we can show you what we've been working on for the past 2 years. So.
Awesome. Thanks, everybody.
Great. Thank you for having me.
Appreciate
Bye. Thanks,
you.
Patty. Bye, everyone.
Bye.
Bye.